I'm going to be honest. Today's video is going to be a little weird for me because I am going to touch into my own fears and my own anxieties. So, a couple comments that I've gotten on the channel thus far have been about these, my teeth. And some of the comments have been nice and super sweet, and some of the comments have been quite mean, actually. I have had comments about how there are like a mountain to floss between, stuff like that. Also, no one really noticed, but I have a chip in that one, and I am waiting for my dentist to fix it. So, with that said, teeth are something that can certainly impact our mental health. I have always had a gap in my teeth. I actually used to have far more crooked teeth when they grew in the beginning. They evened out, though they were very crooked on the bottom, but they straightened over time. That is, just what I was given. These are my teeth. So I am going to consider Invisalign for the top, only to fix my bite, not because I think that I absolutely have to, but I don't think I should do it because others want me to. Now, part of the reason I want to talk about mental health and teeth is because I am not the only one who cares about my teeth. That's why it's an insult in Mean Girls.
Alyssa, I'm sorry I called you a gap-toothed. It's not your fault you're so gap-toothed.
And gap tooth has been made fun of for a long time. And studies have shown that individuals with mental health disorders are more likely to experience poor oral health, and a systematic review found a significant association between common mental health disorders and tooth loss. Individuals with these disorders had higher rates of decayed, missing, and filled teeth surfaces compared to those without mental health issues. So that is very interesting, and that comes from a 2022 article by Tavares. And as always, all references will be below. This channel does utilize citations and references, so there will always be references. And I do find it curious, too, that there's also a socioeconomic position for oral health that was noted by Heaton in 2024. And Heaton says that mental health conditions and poor health outcomes share bidirectional links, and both are linked to factors related to socioeconomic position. So this is very interesting. So poor mental health, bad teeth, and being low income all come together. So this is actually a huge socioeconomic issue because we are talking about poor people having worse mental health and worse dental hygiene. And that is a form of healthcare. So while my own teeth do have things that I might cosmetically not love, like this, I have only actually had cavities filled one time, and it was for 3 cavities, and I was 30. I'm very grateful. I'm very blessed genetically with my teeth. Sure, there's a gap, but they have been very strong. They have helped me through so many years, and I am very blessed that I have not had more cavities than I have. And I will not name this dentist, but I had a dentist tell me that yes, she understood that Coca-Cola was bad for teeth, but she was also wise enough to know that I was using it to comfort myself. And she said, look, teeth matter, but so does mental health. Don't be too hard on yourself if you have some Coca-Cola. And I found that very interesting that my dentist understood that there was a mental health problem there too. Teeth are a part of our bodies. We are seeing that people with mental health also have poor dental history. So I am glad that we have research with this. So I want to read to you this quote from the first article by Tawari that came out in 2022. And it states, in patients with depression and anxiety, past research documented the association between the use of oral health services and tooth loss. Many depressive symptoms, such as anhedonia or lack of motivation, feelings of worthlessness, and fatigue, may adversely affect adults' behaviors related to oral hygiene maintenance. Several studies demonstrated similar results related to depression, dental behaviors, and the management of dental diseases such as periodontal disease. These studies highlight the public health implications of mental health on oral health outcomes and the potential cycle of relationship oral health has with mental health and vice versa. Greater risk for dental decay and tooth loss can lead to more frequent pain experience, social isolation, and low self-esteem, and reducing quality of life, and in turn, possibly being associated with poor mental health overall. So yeah, as a therapist, and this video is not therapeutic advice, obviously, this is just my opinion. Mental health and dental care are obviously related, and you know what? I'm not surprised. Have I had many a nights worrying about cavities this chipped tooth? When I chipped it the first time, you would have thought the sky was falling. I canceled all of my appointments. I refused to get on camera. I refused to even leave the house. And now I have gotten over it and I'm recording video. So all of that is getting better. I have, worked through my own feelings, but I will say it took some CBT. It took some radical acceptance that it is just a tooth. At least I'm not in pain and my dentist will fix it. I do want to note that that is not the only study on socioeconomic position and oral health. There's another one from 2024 from Heaton, and I'm sure there are many others, but I do want to note this one because they did do a good overview, I think, as well. And the implication of that study was that they emphasized the need to integrate medical, dental, and behavioral health to provide comprehensive person-centered care for, teeth and mental health. So I do think that there is a therapeutic approach to considering dental health. And Time magazine has an article that does cite some of this research called How Depression Can Affect Dental Hygiene. And I think that is a very interesting article as well. There's a very important point in here by someone that Time magazine interviewed. And this person says, it's something that I'm embarrassed about because I'm like, what is the dentist going to say when they look at my teeth? This was by someone named Howard. And you know what? I understand. I felt that. I felt shame that my teeth were suddenly worse, that I had cavities. I didn't want to go to the dentist, even though that was obviously going to be the only cure for cavities. And I do think that there are so many things surrounding mental health, socioeconomic status, disease, well-being. Like, there are so many factors of teeth. There's physical health. There is not wanting infections from having cavities, the necessity of root canals if things get worse. The pain that you're in can impact quality of life. Teeth are not just teeth. I am going to put the very, very smallest little section on veneers and Veneer Techs. This has been going on all over the internet, and I have watched several videos on Veneer Techs. I believe Cece Suarez did a video. Lael Hansen, her content is absolutely amazing, by the way. I love Lael Hansen. And I think Isabella Lanter also did a video on Veneer Techs. I will link to their channels below because I think that they do really great deep dives on veneers. And if you have a weak stomach or you're eating watching this video, yeah, don't go watch it. So veneers are something that if done by a qualified professional, someone who's gone to dental school and can operate on your mouth, they can be a good solution for teeth that have seen a lot of wear and decay. And veneers are basically this horrifying procedure where they shave your teeth down to little stubs and then they cover them with the veneer. And as someone who has those nightmares of like your teeth falling out or stuff like that, you see videos of people with veneers and their teeth will literally fall off because it's a veneer capped on what is shaved down, and watching that content makes me incredibly, incredibly uncomfortable. I'm glad that I know it exists. I'm glad that I understand at least a little bit why people might want that procedure, both for aesthetics, mental health, feeling body dysmorphia, that your teeth are hideous and you don't want to live in your body, and that, you do anything to make them better. So you'll go to a predatory person who is illegally doing veneers, and that's what these Veneer Techs are doing. And that is just absolutely horrifying. There are people that will go to other countries in Europe and get super cheap dental surgery that real dentists are later looking at and having incredible trouble salvaging the situation. So just kind of like as a little disclaimer here, if you are going to get dental work done, please go to a dentist. Even if it's expensive, I know it's expensive, but your health matters. And even if you need, like a payment plan or something, many dentists will work with you. Some clinics even have free days. Some dentists have clinic days where they'll do free dental work on such and such patients during the day. You can look for those resources. You can look for low income insurance for dental. Please do not put your teeth in the hands of an untrained professional because that is very dangerous to your physical and mental health. Because if your mental health for your teeth were bad before, imagine what they'll be like if you get scammed and then have irreversible damage. So please just avoid those scams. And maybe if you were considering veneers, look into some of those videos I talked about and do more thorough research, including looking at reputable sources like actual dentists. So what's actually interesting too is another article talks about children being bullied from their teeth. And this is incredibly sad, but I am not, surprised. This article is from 2024 and it is by Paulo Roberto Martins Maia. I'm saying all the names because I'm not sure which is first and last in this case. And it is called Relationship Between Dentofacial Features and Bullying in School Children. And this article had a conclusion that some and actual perceived dentofacial traits are associated with bullying, so these features in the school children's compliances should be considered to determine the treatment needed. So I do find it a little worrying that this article talks about, doing dental procedures because the child is bullied. And, I think like cleft palates would be one, having lisps, having a gap, things like this. And I do understand that, fixing that physical thing might, stop the bullying from occurring. But I think we also need to have more social awareness so that people don't feel like they should be bullying people for their teeth. And I know that's easier said than done, but I already know that I have a gap tooth. I already know that I'm chubby. And, pointing out people's securities as a way to be mean and get a response, I think that's something that's always going to happen, but that doesn't mean that it's okay. I think from a therapeutic standpoint, we need to be able to teach these kids that are being bullied that just because somebody else thinks this about your appearance, that doesn't mean it's true. You can have a gap in your teeth and they can still be perfectly healthy, lovely teeth that are helping you chew, that are helping you eat, that are in great shape. So I do think, especially in situations with low socioeconomic status and low access to mental health, in these situations, these children might not be able to get braces. And even such, there's people that make fun of people for braces. There was a whole show in the 2000s called Brace Face. I don't know if you remember this show, but it was an absolute gem. No matter what with your teeth, other than, the perfectly straight white tooth, and even then, there's people with veneers that are perfectly white and straight that people are then saying, oh, this person has chiclet teeth. It's almost like you can never win. Everybody's teeth, for some reason, have something wrong unless you have Hollywood teeth that are perfect. And guess what? There are people making videos upset about those Hollywood straight teeth not looking natural enough, especially when they're cast in historical roles. And I do want to put a link to a wonderful fellow creator who talks about that. And I just find it absolutely crazy that no matter what you do, somebody is going to dislike your appearance. So for me, it comes down to, do I like my appearance? Am I comfortable? And sometimes the answer is no. Do I like my gap? No. Have I ever liked it? No. Can I live with it? Yes, because it is part of my body. And someday I might get Invisalign. I'm looking into it, but at this current moment, I cannot afford it. And because I can't afford it, it is not worth dealing with. And the channel I am thinking about, I just see it here, is Regency Rumors, and I will link that video below. That content is wonderful. I love that she has a literary and historical lens, especially myself as a writer and lover of literature. So they call the phenomena of people who have those straight, perfect teeth, maybe have Botox and fillers. They have absolutely no lines on their forehead. Because obviously people back in the day, they didn't have Botox and filler. They call that iPhone face, and iPhone face means that the person in that historical piece looks like they could know what an iPhone is. I think insecurities are natural because we all want to be part of our social group. We want to fit in. We want to feel like we belong. And on the other side, people will use those insecurities to make you feel like you don't belong and that you aren't deserving. And I think in these cases, my suggestion would be to do some journaling, to do some radical acceptance exercises, to find and talk to your own therapist about this. If it's something causing you distress, you are not alone, and it is totally fine to feel distress about your teeth. There is, research on this. It is a real thing. There are people going to extreme measures to fix it, which please do not, please, 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 if you take anything from this video, it is that you do not need to go to an unqualified professional to fix a problem that you may not even have. So, yeah, I had fun talking about my insecurities today and my teeth. And honestly, I think talking about it is helpful to me because reading all this literature, looking at it, looking at these citations has made me kind of feel like, okay, yeah, I have a gap in my teeth. My teeth aren't perfect. A lot of people's teeth aren't perfect. We are human beings, we have bodies, and sometimes our bodies aren't exactly what we see on the television or aren't what we wish we had. And in some cases, we may decide that for our own mental health that we want to change it. And if we do, I believe that qualified dental professionals, in that case, for any physical alterations, please always go to a trained professional. Your mental health is important. Your physical health is important as well, and your safety should always come first. So I hope you have a lovely day, and me and my teeth are going to go relax.